when we talk about soft tissue balance around the knee, most people present to us with some element of deformity. Whether one side is tight, one side is stretched, or a little of both. We need to restore that soft tissue balance or the ligament balance as close to normal as possible. And so whereas before we used to make arbitrary bony resections and then release soft tissues in an attempt to balance them, now we plan our surgery, we reference the soft tissue balance, we can release or balance that a little bit before we even make any bone cuts. Most of the time when we're working through this process, we find that true soft tissue balance is not achievable without subtle changes in the implant position. That's not possible without using a robotic system. Using it, we can then adjust that implant to optimize that soft tissue balance in that individual patient. And so that is how these knees end up feeling better in the operating room, rehabilitating easier for patients, and why patients are happier with them sooner.
The knee joint is actually 3 joints, it's not 1 joint, and we have what we call condyles, which are the big knobs on the end of the femur. And imagine, if you would, a car that had 4 different size car tires, and they all had different radiuses of curvature, and you want to make that car drive down the road smoothly. That's a pretty big undertaking, yet that's what we have to do when we do a knee replacement, because the condyles are different sizes, they have varying and different radiuses of curvature, and therein lies some of the technical difficulty in trying to balance the knee that Dr. Gorczinski was talking about. Almost everybody's gone to the dentist and had a cavity filled. And when they first fill the cavity, they ask you to bite down, and almost invariably it is high. You can't bring your teeth together. That's imbalance. And if they let you go home like that, you'd be terribly symptomatic. When we haven't balanced the knee properly, it would almost be like sending somebody home with a high filling and the knee just doesn't feel right. What's the dentist do? He asks you to bite down, he shaves it until it's just right. Well, we can do that through the use of our balancing process, so that when we do make those bony cuts, that filling, if you would, that resurfacing of the joint is done to such a precise level that it fits right and everything balances, and you don't have a high spot that's very uncomfortable.